we're live at the BRECAN Job for Life 2025, and with us here is, please introduce yourself.
Betty, I am Akeredolu, the founder of BRECAN.
Okay, please can you tell us what BRECAN is about and how long it has been in existence?
BRECAN is about raising awareness of breast cancer, supporting patients, championing advocacy for better treatment for patients affected by cancer, breast cancer, and also in research.
Thank you. What's your relationship and partnership with Tambo Foundation like?
Well, the founder of Tambo is like my daughter. She was a classmate of my son, Akeredolu. They all went to ISI, and before then, I'd known the parents. Coincidentally, their wedding day was the same day with ours, so we've come a long way. I would say that she is a family to me. When I learned about her own diagnosis, I just shuddered. I said, how could that happen to such a young person? But we now know that breast cancer can even affect young people, especially in this environment. Initially, we thought that it was a disease that affected older people. But now we know that young people can also be affected. Therefore, it behoves on us to continue raising awareness, not relenting, letting young women be very much aware. Don't say, oh, it can't be me, because we now have evidence that even young women, are affected by breast cancer. So let me also add that I was really thrilled, delighted that she's part of this job event, and her organization Tambo supported BRECAN handsomely.
Well, in the years that BRECAN has been in operation, how well will you say they've impacted the society?
We have, honestly, we have. You won't believe it, when I was diagnosed in 1997, I was like a lone voice in the wilderness. But today, the story is different. I didn't give up because I appreciated the fact that when you detect breast cancer early and present early and follow up with treatment, because these are the 3 steps we try to emphasize, that your chances of survival are greatly enhanced. Detect early, and how do you go about that? Breast self-examination, very important. Go for your screening, mammogram, and then once you notice any unusual changes, which we all know, long discharge from nipple, discoloration of the skin, and so on, don't assume that it's nothing or it's not painful, because here in our climb, it's only when something is painful that people go to hospital. But that's not the way breast cancer presents. It could be painless, like I said, painless lump. It could be just a reddish rash on your breast. Please go to hospital, let them check it out. But I also want to add that not all these signs might turn out to be breast cancer, but it's always better for your doctor to tell you, do not assume. So having said that, our women they are waking up. Nigerian women are people, they don't agree. Things that they are not familiar with, they tend to shy away from it. They don't want to know. They say, what? Not something will kill person. Something where I know no go kill me. But that's not true. Breast cancer is ravaging our women, at alarming rate. But the good news, like I said, when it comes to awareness, things are getting better. I can't tell you the number of women who would meet doctors at UCH and said it was because they had my voice. They had Mrs. Akeredolu's voice on radio, or they saw me on television talking about breast cancer. And they said, if this woman looking like this, looking like Gen Z, looking like Gen Z, it means she had breast cancer. I'm talking about 28 years as of today and still counting. Then I should be able to see a doctor. And that's the kind of empowerment I want our women to have through this awareness that we are doing. You saw how we are jogging along the street. People should be curious and ask, what are these people doing on the street? It's about breast cancer awareness. It goes a long way in empowering our women to get up there and go to hospital. Not pastor, not your prayer warrior and all these things. Breast cancer not the hear prayer. You have to go to hospital and they check it out. So there's getting better, but we've not gotten there because many women are still presenting late as I speak today.
How can the society at large help the organization do better to more for everyone?
Our biggest headache is funding. We need money. Awareness needs money. For us to organize this, it needs money. And we need to get out of Ibadan and go to the hinterland, into the villages, and talk about it in the languages they understand. That is a serious handicap. So we keep asking government to be interested in awareness creation. I always say that awareness is the entry point to survival. Not going to hospital, that's not the entry point. Because you need to be aware. When you are aware of what is happening to you, it empowers you to make informed decision. And the first decision is to go to doctor. But if you are not aware this thing is happening to you, how would you know that you're going to doctor? Awareness should be taken to the nooks and crannies of this country. Then we know that we are talking. But you need that funding support to do things, just like we put this together. So that partnership with government, partnership with higher institutions, and a big shout out to Dominican University. Yes, a big shout out to them. All of them, definitely they have become advocates. They will become advocates. When they go home, they will teach their mommies how to do breast self-examination, which will definitely teach everybody. It's a powerful tool to detect breast cancer early. Apart from institutions, corporate bodies, corporate Nigeria, we've been shouting. They should support us. One business that is here is Aquatech Farm Ventures. They are supporting us. And then some other, corporate bodies too. But we can do better. You can imagine the number of businesses in Ibadan. If they were able to be here, Dominican will not contain us. But you will not relent. We have to keep talking about it. Because breast cancer must happen to a woman. This one they say, Nigeria don't happen to you. Breast cancer can happen to you anytime. Anytime. They look face, so they send. So that is it.